When divisions were set up in 1992, we started with 10 divisions then. It became about 121 divisions at one stage. It's down to 119 at this moment. They're individual entities. Those days have changed totally. For us really to operate in division land, we have to operate as a network so that we can provide services or provide rollouts of government, federal government, state government projects all around this country. In fact, what we do in divisions is we deliver local health solutions through general practice. To do that appropriately, we have to have coverage across the whole country.
Okay. So we're talking yesterday about what the divisions do and what's the message. What is going to be the message then from divisions?
What we need to do in divisions is make sure that we're not probably Australia's best kept secret. I think it's very hard, or has been very hard, for us to explain to stakeholders, whoever they might be, exactly what divisions do. And the reason for that is divisions do a large number of projects, but in a very locally specific way. And one of the things divisions have been very bad at doing is explaining to people what it is that they do and what they actually achieve for health and for general practice out of those projects. We've got a new project or a new approach in place where divisions will liaise with their local newspapers, their local media, their local politicians, and make sure all of those people know how important they are to primary health care in this country.
All right. And there was talk yesterday of effective resource management. Is that going to be a bigger role in the divisions as well, the networks?
We think effective resource management is fundamental to divisions' future and also to general practice. What effective resource management is about is divisions and general practice taking more, I suppose, responsibility, not just for say the medication that GPs prescribe or the tests that we prescribe or the referrals that we make, but also the value of those. In other words, the cost as well as everything else, as the clinical outcomes. We think that by putting some, I suppose, power back in the hands of GPs here, there's likely to be savings to the system. And we think that some of those savings should be ploughed back into local health priorities determined by the consumers and general practice. In other words, we want to empower GPs to really change the way primary health works in this country.
And there was also talk about GPs or divisions measuring what they do a lot more. Is that going to be something?
Part of effective resource management really is having significantly better data for general practice to be able to look at how they're practicing and how that compares with national best practice, and probably as importantly how it compares with other GPs in their region or in their division. We've found through the collaboratives approach and other programs that it's interesting how often GPs might think they're doing a great job, but when you actually look at the data, they might only be doing HbA1c levels for 30% of their diabetics. They thought it was higher, but when you look at the data, it wasn't. This really, again, empowers GPs to do the best job that they possibly can, and we know that's what GPs want to do, and certainly what the patients want.
And final question, I mean, what kind of reaction have you had so far from people talking to the move towards the move of networks?
I think everyone's really positive. I think the divisions network, all of the people involved, the GPs, the staff and others, are really looking for, I suppose, a new phase of the divisions network, one that is empowering, one that isn't reliant totally on government direction. We want to set our own direction. We want to empower general practice, empower our consumers, and get on with the job of better chronic disease management, better management of our ageing population. In other words, get rid of, I suppose, the ties or the dependency maybe we've had on government in the past.